Assalamu alaikum, everyone. Welcome to the Arise to Success show, where we aim to highlight inspiring individuals and their journeys to success. My name is Gehad. I'm your host in this show. Today's show is pre recorded, so we won't be able to take any live questions, but please feel free to text or WhatsApp your thoughts about the show on 779 481822. Alternatively, you can comment on Facebook as well. So our guest today is Dr. Sukaina Dada, who's a pediatric occupational therapist who has worked with disabled children and youth in various community and healthcare settings. She's the founder She's the founder and executive director of Smile Canada, which is a Canadian charity supporting newcomer children and youth with disabilities and their families. Dr. Dada holds a PhD in critical disability studies from the School of Health Policy and Management at York University. She has recently completed a visiting postdoctoral fellowship at York University, developing an artificial intelligence search engine for disability advocates globally. She has an upcoming book this year, inshallah, which addresses the critical intersections of disablement and displacement impacting disabled refugees, children, and their families. Dear listeners, as one of the themes this Ramadan, inshallah, or this week specifically, is to think good of others and to be patient, inshallah, we'll be addressing this in today's show throughout, inshallah. Dr. Skaina, so lovely to have you with us on the show today, and welcome to the Arise to Success show. How are you doing?
Alhamdulillah, alaikum salam. Thank you for having me.
Alhamdulillah, great to hear that too. Alhamdulillah. Just making sure I'm pronouncing your name correctly. It's Dr. Sukaina, right?
So yeah, quick tidbit. So my name is Sukaina. Everybody in my life calls me Sakina.
Uh-huh.
But yes, that was pronounced perfectly.
Okay, alhamdulillah. So, mashallah, with the amazing work that you're doing, Dr. Sukaina, and there is a lot more that you've mentioned in your bio, but I wanted to leave that to you for us to tell us a bit more about you and the amazing work that you do, mashallah.
Well, thank you. I mean, it sounds really intense when you read it out loud. But honestly, alhamdulillah, I feel like my academic journey, my professional journey, and this is something that I absolutely love. It kind of just all happened one after the other.
Mm,
So when I was younger, I had this experience whereby I brought my cousin from Tanzania over to Canada. When I
mm,
was in Tanzania, I saw him, and he was not walking, he was not talking, he was not involved in any activities. He wasn't going to school, and I thought, you know what? When if we were to bring him over to the global north, over to the west, then his life would really change drastically. And
mm,
then when we did that, we realized that in the global north and the west, there's also many issues of inclusiveness, and
mm,
it's a guise that in this part of the world things are so much better.
mhm,
And there were other complicated issues. For example, just the Islamophobia within the system, the difficulty navigating with language, and with cultural barriers. And so I decided to go on to become an occupational therapist. And so I did that. And I worked for a number of years. And when I was working, I realized, within the system, it's not really designed for the most vulnerable, for the most underrepresented, for those who are underserved. And so I went on to do a doctorate degree in displacement and disablement in the School of Health Policy and Management. And alhamdulillah, honestly, that is what I'm involved in right now, with my work with Smile, which I know we'll get into. And that sort of that trajectory, takes me where I am today.
Mashallah, subhanallah, that's an amazing background. And a lot of people as well, they do talk about their own personal experiences that led to what they do now, mashallah. So that I'm assuming this was your main motivator to do this, or was there anything else motivating you and the journey of that? Is there anything else that contributed?
I mean, this was the main motivator, but I guess what started
Mm,
happening is, as I got into this work, I started meeting so many families who looked
mm,
like mine,
mm,
families who had the same struggles, families who left, their countries, whether Egypt or Sudan or Syria or Pakistan,
mm,
to come. to Canada for what we call like a better life, right?
Mm,
Which is the immigrant, for many people, it's the immigrant dream.
mm,
And I think what we don't account for sometimes is all the difficulties. For example, in one of the studies that I did, so many people who were not related to each other
mm,
would say the same phrase, that I left my informal supports for
mm.
formal supports, not
Wow.
realizing that those informal supports, like extended family, the neighborhood culture, the community culture that
Mm,
sometimes living in a different country, they said I left that for formal supports of physicians and therapists and these specific workers, not realizing how much those informal supports had meant to me in my life.
mm. Wow, subhanallah. This is quite powerful, subhanallah. And in terms of, your journey starting that, I'm wondering how was that for you to set up something like this that is very rewarding. Not many people, or that service is not available quite a lot. I don't know how it is in Canada, but certainly, as you mentioned, in some countries, and that's why they go to other countries for this kind of support. How was your journey in starting and setting something like that?
I mean, like we just did it. A few
Mm,
friends of mine, we were in our undergraduate at University of Toronto. We were doing
mm,
our undergraduate degree, and we decided, you know what? Like I said, let's just start something small. It was like a club.
mm,
You have
mm,
these like campus clubs.
yeah.
So let's just do something small. Let's get some people in a room. Let's give them maybe an event. Let's
Mm,
do something nice. It became one of those things like let's do almost like a little project.
mm,
What quickly happened is we realized that there's a much bigger systemic issue here.
mm,
And so, you know, out of that came Smile Canada. And when I was doing my master's in occupational therapy, I had the opportunity to do a study.
mm.
Sometimes when you go to, different healthcare systems and academics and you're trying to propose this idea, the first question everybody asks is, where's the data? And so
What's the question?
where's the data? Like, where's the evidence?
Yes, yes, yes,
And
yes.
although it's something we've seen firsthand,
Mm,
it really didn't matter. It
mm,
was, where's the evidence to support your claim that these people are not getting the support that they need?
mm,
So I said, okay, I can play that game too. And so I did a study. And
mm.
the study looked at the lived experiences specifically of Muslim families with children with disabilities.
Wow.
And as a result of that, the study showed that regardless of their ethnicity, regardless of their cultural background or the language they spoke, everybody was saying the same thing. They were saying that while services and supports may exist, we don't have access to them. And from what I understand, it's largely like that in the UK as well, and in
Mm,
America and in many parts of Europe, where the barriers of language, of culture, of access are
mm,
real.
mm,
For example, we have translation services, as do you. And the issue is sometimes you have to be able to navigate technology in
mm,
order to access that. And you have to be able to know where to go and who to speak to.
mm,
Well, the difficulty is many people that we work with, they just got here, right?
mm. Yeah.
And they don't necessarily have A, those resources, but B, they don't necessarily have the understanding of how to go about doing certain things.
Yeah.
There's no guidebook when you land, how to
Mm,
obtain a family physician,
mm,
how to get, how to figure out how to get your dental work. And in a country like Canada, while we have this perception of universal healthcare,
mm,
it doesn't include vision, it doesn't include dental, it doesn't include many therapies. And so these added costs, they're covered for those people who have good insurance,
mm,
right? So if you want your kids to go to the dentist, if you want to go to the dentist and you want that expense to be covered,
yeah.
that really is now a third party payment.
Mm,
And so more and more in this research, we were seeing that many families are being underserved. And we use two terms at Smile, and one is underserved and one is underrepresented.
Wow.
While they're underserved, they're also underrepresented within the research, the data, but they're also underrepresented when you go to visit some of these programs or you see who's accessing many um, of our communities. And I say that plural because, our cultural communities, our respective, ethnic communities, many of them are not being represented.
Wow, subhanallah. One thing I love about what you've mentioned is when you were asked where is the data, you didn't give up. You went and looked for the data, mashallah. And that's something really important because when we try to set up something, or a lot of things in life, things will not go the way, as lovely as we think or as we would want to. But I think it's very important not to give up on your dreams and either find something as you've just done there, or sometimes it could be that something that you need to start up yourself, and mashallah this is something that you've done, and I thought it's very important for me to comment on this because especially young people, adults as well, and young people, we're faced with a lot of things that can give up can be the easiest option. Giving up can be the easiest option, but inshallah, with commitment, and remembering that Allah is always there, putting that tawakkul on Allah and taking action is very important, inshallah, for amazing things to happen, like the work that you do, mashallah. And with what you've said about the families and the children, young people having that support, how important is it to provide that support for the young people, the children, as well as their families? Young people and children, I was referring to those with disabilities because that's the work that you do. How important is it to provide them with that support?
So, I think it's twofold. One, it's our faith, right? Like service to others is our entire faith.
Of course.
And we see, mashallah, within our communities, whether in the UK or in Canada or in any other country, we see this is really, this is integral to the Muslim faith. So you see people work, for example, supporting orphans, or people are helping, others by building a well, or people are helping others by providing food, or, there's a lot of work right now being done with domestic violence. And all of these are important.
Yeah.
Because really what we have to do is we have to look at any group of people who require support, and we need to support them, like hands down. I find when it comes to disability, pediatric disability, and health, and the reason why I say and health is because Smile supports children with disabilities from sort of like that term, not to get too philosophical, but it's not so much for us about the diagnosis as it is about the prevention to engage.
Yeah.
So, for example, most recently we have many newcomers, refugees, evacuees coming to Canada who are directly impacted by war and displacement. And so their disability, in a sense, is a result of a lack of food, a lack of medicine, a displacement from one area to the other. We see a lot of pediatric trauma as a result of immense grief and violence, structural violence. And so in that sense, we see disability manifest. But it's not necessarily always a developmental disability that somebody is born with. It is a result of very systemic issues that as a world, as a global society, we have to own, right? And so in that sense, we work with families who are impacted by disability, but we also work with families who are impacted by what we call critical illness. For example, pediatric cancer is on the rise. And many of our communities are not necessarily speaking about how much these long-term critical illness are on the rise.
Yeah.
More and more, we're seeing children with not only developmental disabilities, as many of us know, for example, the rise in diagnoses like the autism spectrum. But we also see pediatric illness on the rise. To experience long-term illness, whether cardiac or different types of cancers or different issues in the blood. And And what happens is, as a population, I think from my own research and just my own experience doing this for so long, I feel like there's a bit of a guise. There's a bit of a sort of mystery, an idea that lingers. And I won't say in other parts of the world, but at least I can say here in Canada, that the idea that lingers is the government will take care of them. And I think that this idea is, number one, I think it's quite dangerous, because then we sort of absolve our responsibility of supporting these children, and then as a result their families as well. um, and I think that's very difficult. I think it's very dangerous. And so this is really where Smile Canada was formed, and this is where Smile has really put, we've put our efforts. I work with a wonderful team, and we've really put our efforts in not only trying to provide direct support to these families, but also trying to raise awareness to the communities, whether our faith community or the broader community, saying that this population is one that should not be overlooked. This is a population that deserves our attention, not only from a faith perspective, serving those who are underserved, but from a societal perspective, saying that anybody who sort of is underserved, anybody who is overlooked, is a population that deserves our attention.
Yeah. Wow, subhanAllah. I'm just going to remind our dear listeners, just in case anybody joined us a bit later, is that we have Dr. Sukaina Dada on the show with us today, who's a pediatric occupational therapist who has worked with disabled children and youth in various community and healthcare settings. She's the founder and executive director of Smile Canada, which is a Canadian charity supporting newcomer children and youth with disabilities and their families. Just a reminder, dear listeners, that today's show is pre-recorded, so we're not able to take any questions, but please feel free to text or WhatsApp your thoughts on 0779 481822. Dr. Skinner, that has been amazing. I've also been thinking about the flip of that in terms of what happens when we don't provide those individuals with support, children, young people, disabilities, as well as their families.
I mean, I think the cycle of the systemic issues, they continue, right? We see, for example, in Canada, less than 6% of expenses related to pediatric disability are covered by the government. The reason why that number for a lot of people gets overlooked, I think, is because there's just an assumption that, acute healthcare and long-term health is all the same. So, for example, whether where you are, whether where I am, if we're sick, we go to a doctor, right? If we break our leg, we go to a doctor. We generally will get a cast. We might get some sessions for physiotherapy, but that's for something acute, right? So something that can get fixed. And there are many, many systemic issues here that have been researched for so long, because we put a value on somebody who can get fixed instantly. And it's very unfortunate that we do that as a society. But if somebody has a long-term mobility issue, they actually get less support than if somebody has an acute mobility issue. Right? And so this is something that is ingrained, embedded within our education systems, within our healthcare systems, within our social systems, our social service systems, that we put more value on a person who we think can contribute better financially, better professionally. And this is something that has been researched. This is something that has been proven, that there's systemic issues within our societies that really devalue persons with disabilities, that devalue persons with critical health issues. In my research on displacement and disablement, I came across some very glaring statistics about even that intersection between displacement and disablement. So, for example, persons with disabilities, they are the most vulnerable when it comes to displacement, which doesn't make any sense, because disability oftentimes is a direct result from war and from violence. Right now, we're seeing, for example, in Palestine, in Palestine, that it is the most recorded number of pediatric amputations.
Mm.
So from the world who is working to support children with disabilities, that should be a statistic that is moving the healthcare world,
Yeah.
but it's not.
Yeah.
And it's because, we sort of are trying to remove socio-political issues from healthcare issues, but healthcare is a political issue. And the
Yeah.
reason why I say that is because we can survey all of the communities around us, and we can see people of color, Black communities, for example, faith communities like Muslim communities, they get less service and less support.
Mm.
And so we have to ask ourselves, why is that, right? Like, why is it that, the world is turning away when we have such jarring statistics in front of us?
Mm.
I recently gave a talk at a nearby hospital, and somebody said to me, the hospital is no place for politics. And
Oh.
I said, okay, fair, except I am politicized.
Mm.
Politicized by the color of my skin, by my hijab. I'm politicized by my name. And so as a result, I might walk into a hospital and get a different type of service than somebody who doesn't look like me.
Mm.
Somebody with an accent might get a different type of service. Somebody who has limited English might get a different type of service. So it's not that they're bringing politics into the hospital, it's that they are politicized.
Wow.
And so if we don't address that, whether as healthcare workers, as educators, as social service providers, whoever we are, if we choose not to address that, then I believe we're doing a disservice to the children. I really do. And I think that children and as a byproduct, as a result, their families by extension, I think that many people are being overlooked.
Definitely. Wow. It's quite powerful, especially with what you said about, the ones with basically an issue that's quicker to fix has a better priority, or higher priority. And it just made me think, what message is it sending out there? And you've given enough detail on that, and I was like, wow, subhanallah. Certainly an area that needs to be addressed and fixed, and hopefully that can be done, inshallah. And it's sending a message out there, inshallah, to others that this is something that is a gap that needs to be worked on. And inshallah, some of the listeners who are listening can be inspired, and hopefully can we collaboratively can, inshallah, address this issue, inshallah. So I think you want to say something.
Yeah, so I was just going to add in, when it comes to children, we always tell our children like how much we love them, right?
Yeah.
We always are telling our children how we're proud of them,
Yeah.
how we're so happy for what they do. And when we devalue children, the impact of doing that, it's lifelong. And not
Absolutely.
only as an individual, but as a society, as a community.
Yeah.
We show our children, if we don't make our spaces inclusive and accessible, we are telling our children that only some children matter.
Absolutely.
And I never want to go into a space and make people feel that they're not doing good enough. I recognize that there's difficulties even within our own Muslim communities. We're always trying to do better. We have limited resources, but I also always say when I go into a space that us not supporting children with disabilities and critical illness and their families is placing a value on children who are able-bodied, for example.
Yeah.
And whether we're doing it intentionally or unintentionally, to me, that impact is the same. We're telling our children in Islamic schools that you're far superior than the children who don't have access to be here. And that to me is a value that's placed on children that is actually, it's very harmful.
Yes.
And it goes against the principles of our faith. And so I think what we have to always do as a community, as a society, individually and collectively, is we have to ask ourselves, whether unintentional, and I do believe it's unintentional, but are we placing values on people, um, who appear to be uh, more able to give back, to do well? And if we're doing that, where does that value come from? Like, is it
Yeah.
coming from our faith, or is it just coming from us sort of feeding into some of these broader systemic values that are part of the society that we live in?
Absolutely, absolutely. It doesn't only affect the child, but it also affects the way I see the whole society, because that child grows with that mentality. It affects them confidence, self-esteem. They're not able to contribute to the society. So it becomes a societal issue, not just an individual's issue. We're reaching a break, so we're going to go for a short break. Dear listeners, this is Inspire FM Luton on 105.1. Inshallah, we're going for a very short break, so please stay tuned and we'll see you shortly. Assalamu alaikum everyone. Welcome back to the Arise to Success show. We have Dr. Sukaina Dada with us today, who is a pediatric occupational therapist who has worked with disabled children and youth in various community and healthcare settings. She is the founder and executive director of Smile Canada, which is a Canadian charity supporting newcomer children and youth with disabilities and their and their families. Dr. Dada holds a PhD in Critical Disability Studies from the School of Health Policy and Management at York University. She has recently completed a visiting postdoctoral fellowship at York University, developing an artificial intelligence research engine for disability advocates globally. Dr. Skinner has an upcoming book in 2024, so this year, inshallah, which addresses the critical intersections of disablement and displacement impacting disabled refugees, children, and their families. Just a reminder, dear listeners, we won't be able to take any live questions today, but please feel free to send or WhatsApp your thoughts about the show on 07794818822, as today's show is pre-recorded. So, Dr. Skinner, you've addressed very, very important areas before the break in terms of the message that we're sending to children, both who are able, who are, have, or those who don't have disabilities, that, those who are able, they have more value than those who are disabled. And that's what I added there as well, is that I feel like it's a societal issue where that child who's got disabilities, they grow up thinking there is something wrong with us, we can't contribute to the society, and that affects the whole society and becomes like a vicious cycle in that sense. And you've mentioned a lot of things that children with disabilities, young people with disabilities, and their families face, the challenges that they face throughout their lives. I think it's a really, really important topic. And perhaps if we talk a little bit more about it, are there any other challenges that they face, so that I'm sure a lot of our dear listeners can relate to this listening, as well as for us to see the seriousness of this issue, and hopefully it can help to some of us who are in these areas to do something about it, and to help those children, to provide services, or even for the possibility to get funding to help children and their families, the children with the disabilities and their families.
Yeah, I mean, I think there's a whole slew of issues, and this has nothing to do with the individual, with the person, or with the family, but rather they're systemic issues.
Yeah.
So, for example, any child growing up, whether in the UK or in Canada, in America, or anywhere around the world, our families and the child and their parents, we have some choices to make. We
Mm.
send our kids, for example, to maybe a public school or a private school, and then sometimes we send our kids to, maybe some faith-based classes, whether Quran class or a different type of program. And those are the choices that we have. Those are the choices that we make based off of our resources, our knowledge, our desire. So I'm not here to say that everybody has to do that, but
Mm.
for many of us, myself included, I decide my children are going to go to school, and after school they're going to go to this particular class. And I have that choice because that school accepts my children.
Mm.
And so, many of our spaces are not inclusive. And so it's not even a choice the family has.
Mm.
one statistic, or it's not even a statistic, one point that I find so glaring. I've spoken to hundreds, if no, not even hundreds, thousands of families in my career. And right now, Smile Canada has actively 770 families. And so I have the opportunity to interact with Muslim, children with their families on a daily basis. The number one comment that I get from families is not about equipment or finances or or health challenges. The number one comment I get, or the number one wish, is I wish my child had one friend.
Wow, subhanallah.
And it's not from this person from the same community, from the same ethnicity, race, economic status. It's just across the board. Family, parents, especially mothers, will come to me and say, I'm really interested in this program because I want my child to have a friend. I'm really interested in the after school program because I want my child to be invited to a birthday party. I'm really interested in this therapy program because at the park, I just want my child to play with another child.
Wow.
And when I hear that, I think that's a community issue.
Yes.
Right? Because I feel like when I look at my own children, where do their friends come from? When I look at myself, where did I meet friends? I met my friends at school. I met my friends at after school programs, but mostly I met my friends at madrasa, at Sunday school class, at after school, the masjid program, at, where like we'd go to pray and then everyone would gather and we'd kind of all hang out. And those are the people who invited me to their house. And those are the people who sat with my parents and we all had dinner together. And so the reason why I spend some time saying this is because I really think that, we have to be aware that many of our spaces are not inclusive, and what that does to children and their families. When our spaces are not inclusive, we have to understand that as a result, children are not getting access to, to the basic, not only fundamental teachings that we have to offer, but they don't get access to those social opportunities, which for a child is everything. You ask any child around the world, what do they want to do? Most likely they're not going to say, I want to clean my room, or I want to, I want to have this for dinner. Most likely what they say is, I want to play.
Yeah.
Because that's a natural state for children. They want to have fun. They want to play. They want to interact with friends. And so I say this to just draw some attention on like our collective responsibility towards children who are vulnerable, not by way of their situation, but by way of how society treats them.
Yeah.
Right? That we have to have a collective responsibility, and whether that means us supporting organizations that are doing the work, whether that means going into our centers and saying, wait a minute, like, are our spaces inclusive? Whether it's challenging our spaces, whether public or private, or whether even at our dinner tables,
Yeah.
we're having conversations on how to reach out to children and their families. Maybe it's something we can even do as a family.
Yeah.
Right? At Smile, we have a program called the Hospital Support Program. And on average, every week, there's about 30 to 40 children in this program. And these kids are doing long-term hospital stays for different reasons. Some are there for a treatment like chemotherapy. Some are there for a post-surgery. And it's not that the children are not getting the medical services that they require. It is that families are in hospital for months without social interaction, without support from their communities. And I know it's a really heavy time for many of us, for all of us, I think, just around the world. But I feel like it is now more important than ever before to really be there for our brothers and our sisters. And when I see a child in a hospital who's been there for 7 months, 8 months, sometimes like 15, 16 months, and you look at that mother, and that mother will do anything for their child. And all our program does, and I don't mean to belittle our program or the people who are working for it, but the reason why I say all our program does is because we're not doing anything extraordinary. We provide meals to a family, we provide a wellness package, provide some social support. But the impact that that has on a family is really more than what I can explain. And the reason why I share this with the audience, because I know not, probably majority of people who are listening are coming from the UK and maybe surrounding areas, is that we can all do something like this.
Yeah.
We don't have to be connected to a specific organization to say, you know what, I wonder how many people within our communities are spending all of Ramadan in the hospital. I wonder how we should get in touch with them.
Yeah.
And what happened with COVID is many of us were involved in these sort of like social opportunities, and then COVID hit, and then as a society we said, okay, you know what, because of safety and what's essential and what's not. But post COVID now, this sort of era that we're in, many people have sort of forgotten some of those, going to the food bank and going to do hospital visits. It's become a little bit like, a forgotten area.
Yeah. Well,
And I think that, it's really harmful because people, they need other people in their corner.
absolutely, absolutely. And as you were talking, it kind of giving me that idea where, it can be something as part of school system. So anybody who's listening to us, who are part of school systems, is that it can maybe arranged as I'm thinking of using the word trip, but the way when people think of the word trip, they have certain things associated with it. But maybe like a daily visit, like for example, once a month, once every few months to hospitals like that, to bring a smile to those children, to give like gifts, charities as well who can do such work, and it helps those children as well to give value to those children who are disabled.
100%. One thing I just wanted to add is we have this program run by one of our colleagues, Elena, and she does cards for kids.
Lovely.
What's so interesting is the number of cards we get back that say thank you for sending me a card.
Wow.
Right? Like there's such it seems like a simple gesture,
Yeah.
but it makes a world of difference to even write a card to somebody saying, I'm thinking of you.
Wow. SubhanAllah. It just shows how important even those small actions, because it can make a huge impact on someone's life. May Allah make it make it easy for those individuals and make us means of bringing a smile to those people. And mashallah for you, the amazing work that you do as well. Inshallah, may Allah reward you abundantly for it. And just a reminder to our dear listeners is that we have Dr. Sukaina with us today on the show, who is a pediatric occupational therapist who has worked with disabled children and youth in various community and healthcare settings. She's the founder and executive director of Smile Canada, which is a Canadian charity supporting newcomer children and youth with disabilities and their families. Just a reminder, dear listeners, today's show is pre-recorded, so we won't be able to take any live questions, but feel free to send your thoughts about the show on 07779 481822, or you can comment on Facebook as well. Dr. Sukaina, individuals with disabilities, as we've just heard from yourself, is that they're not always viewed positively, unfortunately, and viewed as disadvantaged. As some of our themes this week of Ramadan is to think good of others and to be patient, how can we practice doing that when it comes to viewing individuals with disabilities?
I mean, I think first and foremost, it's what our faith says, right? And so if we go back, not to get too into this, but we know that from a faith perspective, we've been taught that we all are equal, and that we will be judged based on our deeds, based on our efforts. and many of that is emphasized on how we support others, how we're kind to others, how we're generous. And all of our themes, especially that are emphasized in Ramadan, like, is about giving, giving, giving,
Yeah.
and sacrificing. And I think that, this is something we all know, but sometimes we just have to remind ourselves, remind our children, remind our families, remind our colleagues that we have to look at those who are underserved or underrepresented, and we have to lend a helping hand. We have to support people, and if we don't, we just have to ask ourselves why. And I think that for this value that we place on people, whether it's because of their academic credentials, whether it's because of their financial success, whether it's because of their ability to articulate or to get onto a podium or share, as humans, we do place value on people. You're the smartest in the class. You're the fastest person winning the race. You are the most successful financially. And
Yeah.
this value, there's nothing wrong with celebrating our successes. However, we always have to keep ourselves in check and say, is this value a principle from our faith, or is this value something that we've done on our own? And I think there's nothing wrong with having credentials or status, and especially, we know from a faith perspective, financial status is a good thing, because the more you grow, the more you give. That's what we know from Islamic history. That's what we know. Many people, even at Smile, like many people who support us, we wouldn't be able to do what we did without their support. But at the same time, this value, if we don't check ourselves, then we're devaluing human life.
Yeah. Yeah.
We're dehumanizing. And
Mm.
especially in this era when we see dehumanization all around us, we have to check ourselves and make sure that we're not, even to the slightest bit, doing that to other people.
Absolutely.
We work with people who, like, one of the things we do at Smile is we do education workshops. We go into Islamic schools, into public schools, and we teach children that some of you communicate in different languages. Some of you speak Urdu or Arabic or Somali. Some of you speak English, and some of you communicate using sign language. All of it is a means of communication. We work with children at Smile, some of them who communicate with their eyes, some of them who communicate with their gestures.
Yeah.
At the end of the day, it's all communication.
Yeah.
Same thing with mobility. Some of you run fast. Some of you, like myself, I'm slow, right? I'm not a fast runner. I'm not very athletic. Some children, they move with a mobility aid, like a walker or a wheelchair.
Yeah.
So if we start to look at these differences as human differences, and this is really important for us, also from a faith perspective,
Yeah.
that God has created us differently but equally.
Yes.
Whether it's the color of our skin, whether it's our height, whether it's our build, whether it's our speech. And God also created these differences when it comes to health and disability. And and God has also given us the opportunity to not only recognize differences, but to be able to support and ensure that these differences are not coming in our way, to give back, and to ensure that everybody has what they need to succeed and to grow and to flourish, whatever that means. So, for example, for one child, that might mean, competing in a game. For another child, that might mean being invited to be present, to sit on those bleachers, to cheer on for the child. Like, what we need to do is say, okay, let's give people an opportunity and include them,
Yeah.
without putting all these kinds of restrictions and limits on them. But what I find when I speak to families is they'll say, my child doesn't even have the opportunity to be included because they can't even get in the door.
Wow.
because there's no ramp.
Yeah.
So then when we say, well, no, that child, didn't participate, it's not that they didn't participate, it's that they couldn't
Yeah.
participate, right? We don't give the opportunity in many of our spaces. And then we can't say, well, those people didn't come. I often hear from leaders in our community, I don't think there's a lot of kids who
Mm.
require these services. Well, how would you know?
Yeah.
Right? Like, how would we know if we don't let them through the door?
Absolutely.
And really, that's not part of our faith.
Yes.
That's not at all part of our faith. And so I think sometimes we just have to spend a minute, and myself included, to check ourselves and say, wait a minute, are we really doing the best that we can to ensure that people are included in our spaces?
Yeah. Yeah. Absolutely. And inshallah, that's going to be motivating, inshallah, anybody listening, inshallah, and interested in this work too, inshallah, to be able to offer more. And even us as individuals, we can, each one of us can do something. And if you give an example, something could be very small, but it makes a huge difference to other young, children and with disabilities and their families. And this is the best time during Ramadan, inshallah, to start that, inshallah, keep that habit going as well. We've got about 5 minutes left, and I really wanted to spend some time talking a little bit more about you as Dr. Sukaina and the amazing work that you do. So, if you can tell us a bit more about your recent fellowship at university, developing an AI search engine for disability advocates globally, as well as your upcoming book, inshallah, and when it's coming out. But I would like to just, before you do so, just remind our dear listeners that we have Dr. Sukaina Dada on the show with us today, who is a pediatric occupational therapist who has worked with disabled children and youth in various community and healthcare settings. She's a founder and executive director of Smile Canada, which is a Canadian charity supporting newcomer children and youth with disability and their families. And just a reminder that this is a pre-recorded show, so we won't be able to take any live questions. But please feel free to text or WhatsApp your thoughts about the show on 0779 481 Dr. Skinner, coming back to yourself, we've actually got about 4 minutes, so that's okay to talk about these things in 4 minutes, inshallah.
Sure. So what's funny is I don't know much about artificial intelligence, but I participated. I did this visiting a postdoc fellowship because there is so much information out there about disability, statistics globally, the impact of disability on physical health, on mental health, the number of children displaced and disabled, and like I mentioned earlier in this conversation, the statistics are glaring. They're enough to make us really wonder as a society, why aren't we talking about this more?
Yeah.
For example, the impact of disability on displacement, the fact that children with disabilities are the most likely to be sexually exploited, to be physically harmed, and to be forgotten and to be left behind. And that doesn't make any sense because we would think that the most vulnerable children should be not left behind.
Yeah.
But in fact, we have this survival of the fittest mentality that even goes into settlement services, saying, well, they're least likely to survive, and so they'll be left behind. And so what I did with this fellowship is we looked at the data and mostly coming from international agencies, and saying, how can we make accessing that data accessible? And this is where artificial intelligence is really the future, where we say, I would like to know the number of children displaced in Sudan, for example, who have disabilities. And this is then information that we as professionals, as academics, as community leaders can use then to further our cause and to say, this is why this is important. Quickly leading into the upcoming book, inshallah, and inshallah 2024, I just need to finish up a few notes. This is actually a result of my dissertation that was then converted into a book. And so what I'm hoping to do is really highlight this critical intersection which I believe is not only often overlooked, but I believe it is strategically overlooked. I think that the separation of disability and health from displacement and war and genocide is a strategic um, uh, systemic issue that is separating so that we don't have to talk about the impacts of war on children. Right? And we often don't. We talk about the impact of war maybe on the environment, or we talk about the impact of war on a community. We don't talk about long-term effects. We don't talk about intergenerational trauma. And we don't talk about how that impact goes into communities for years and years to come. And so my hope with this book, inshallah, that it'll highlight how important it is for us to talk about this intersection and how it impacts all of us, and how it should impact us. And it should be something that is studied. It should be something that is not overlooked. A very quick tidbit: in Canada, for example, settlement agencies are often looking at food, shelter, transportation. These three major things, support for employment. Yet we know that the number of children impacted by disability is so high. And so how come we're not talking about disability and long-term health effects? Right? And it's the same in the UK. It's the same in the US. It's the same in so many of the countries we reside in. And so I really am hoping that with this book, with these efforts, that inshallah we draw some of our attention and we keep asking these critical questions, so that inshallah, we hope for change. And no better time to do it, to collectively speak about it. And then of course in the month of Ramadan, as we come full circle in this conversation, my hope is that everybody listening, really, if this is not something you've ever paid attention to, I encourage you, check out the Smile website. It's smilecan.org. If you're on social media, follow the work, and maybe, ask yourself, how can I get involved in this work, whether in my own community or online, inshallah.
Brilliant. Jazakallah khair. Inshallah, your book, inshallah, can be helping, inshallah, other people as well, inshallah, further. So, Jazakallah khair. Thank you, dear listeners. It is the end of the show. So, inshallah, we'll see you next week. Assalamu alaikum.
Take care. Wa alaikum salam.